right. Good afternoon, everybody. Thank you for coming to this webinar. We are very delighted to welcome Associate Professor Erin Hartnett to Sydney Dental Hospital. Professor Hartnett is a pediatric nurse practitioner and a fellow of the New York Academy of Medicine. Her main role in the program is the program director of the New York University College of Nursing's oral health programs, which are the oral health nursing education and practice and teaching oral systemic health, TOSH. Dr. Hartnett has developed a national interprofessional oral health nursing curriculum and has coordinated many oral health interprofessional experiences with NYU nursing, medical, and dental students. She has published a number of articles on interprofessional oral health and received numerous awards, including the 2012 New York Times Nurse Innovator Award, the 2019 Edge Runner Award from the American Academy of Nursing, and just last week, 2020 GES Award for Innovation from the American Dental Education Association Foundation. So please welcome Dr. Hartnett. Thank you. So just before we get started, just quick housekeeping for those who are joining us by Zoom, welcome. If you all can make sure that you are on mute so that it doesn't interfere with the recording, as well as if you have questions, please feel free to type them as you go along, and at the end we will bring them up and ask Dr. Hartnett. Thank you.
Okay, thank you. Okay. Well, good afternoon. It's so nice to be here. I'm really honored to be invited here. Such a beautiful part of the world. I'm really enjoying it. So thank you. So I was asked to talk about senior oral health, which is really the missing piece in whole person care. So improving or maintaining oral health in an aging population is more than just a lofty goal. A healthy mouth is integral to healthy aging in whole person care. And the need for expanding oral health for older adults is unquestioned. Interprofessional teams can really enhance and maintain oral health in older adults with the goal of a better quality of life and improved health outcomes. So just talk today about the need for oral health in older adults, the importance of oral health to overall health in the older population, and just demonstrate some strategies for integrating oral health into whole person care for older people. So oral health is directly related to systemic health, especially in older people. Right now, we have in the US about 73 million baby boomers are moving into retirement age. And older adults with poor oral health are experiencing pain, loss of teeth, poor nutrition. They have an increased risk for systemic infection, more morbidities and mortalities. And with the aging of our population, also this population has grown up with good dental care, a lot of them, and so they're retaining their teeth, but a lot of these teeth have major restorations, and now a lot of the issue is how to maintain those teeth. And our population who are retiring now, they may have had dental coverage, insurance coverage for their whole lives, their whole employment lives, and now they don't have it once they retire because our Medicare benefit does not have any oral health benefit with it. So it's become a real problem for our older adults. So older adults definitely have a lot of serious oral health problems. When it comes to untreated tooth decay, nearly all adults have had at least one cavity, but 1 in 5 or 20% have untreated cavities. And about 2/3 of adults have gum disease. And 20% of our adults have lost all their teeth. Even though we do have 80% with the teeth, there's still 20% of adults with no teeth. And oral cancer is certainly more common in the older population. The median age at diagnosis is 62. Even though we have been seeing a younger trend, it's still definitely in the older age group. And in chronic disease, there are so many older people on many prescription drugs and over-the-counter drugs, which can cause dry mouth, and reduced saliva will increase the risk of dental caries. So there are so many different risks as they age. But if you look at the population, 77% say that they intend to go to the dentist. But then when you check again, it turns out only 37% of those 77 actually did get to the dentist. So there's lots of reasons that they can't get there. If you look at the adults who are saying they are not going to the dentist, the main reason is cost. 40% say they just can't really afford to get there. A lot of people, as they age, don't realize that they need dental care. So we need to educate them and make sure oral health literacy is part of our plan, that they understand that this is something they do need to continue even as they age. Other people feel they don't have time, or they can't get there, or they can't find a dentist who will accept insurance if they have it. Yeah.
There's an issue on the webinar, so I'm just going to stop sharing and share from mine. Sorry.
Okay. Okay. So they do have a lot of reasons that they haven't been able to get there. And if you look at the barriers, they're true. Older adults do have certainly much more poverty. They are living on a very limited income. Most of them lack insurance. I know in the US, we don't have the Medicare coverage, and we have 70% of our adults can't afford to buy dental insurance. And then a lot of dentists are not trained in geriatric medicine, which is really, I guess a new problem as this population is aging with their teeth. Many adults do not have transportation to get to dental care, or they have a disability where it's hard for them to get around, or hard for them to sit in a dental chair, or hard for them to keep their mouth open, or to do their own oral hygiene. And many are in either some sort of institution, either a nursing home or some sort of elder care living, where they really can't get to the care that they need. And a lot of them, as I said before, don't really know that they are supposed to keep getting dental care as they age. So if we think of the mouth as a window to the whole body, and that if the mouth isn't healthy, the body can't be healthy, and it will impact the quality of life. And that 80% of adults, older adults, have at least one chronic disease. And most of our chronic diseases have oral systemic connections. So adults have very complicated physical conditions, and many of the conditions in the mouth can be reflective or contributory to the variety of systemic conditions. A bacterial infection in the mouth can be associated with an inflammation in a remote part of the body. And the oral microbes in the mouth in a healthy person are very different from those in an ill person or an unhealthy person. So these are just conditions that are very common in older adults: poor nutrition, metabolic syndrome, diabetes, cardiovascular disease, cancer, osteoporosis, respiratory infections, rheumatoid arthritis, and they're all inflammatory process, which can be related to the oral inflammatory process in the mouth. So we believe that we don't have enough dentists in our country. We only have about 200,000 dentists in our country, whereas we have 4 million nurses We have about 270,000 nurse practitioners, 12,000 midwives. We have 1 million physicians and over 100,000 physician assistants. So we believe we need to get them involved in helping with oral health in our older adults, because many older adults do see a primary care person, and they need to be, these primary care people need to be aware of what's important in oral health. So we base our model on the WHO workforce capacity model for oral health. We've adapted it to oral health. We believe that we have a need for more oral health workers. And we think that by building our primary care workforce, by educating all of our healthcare students, our dental, nursing, medical students, to collaborate, to have a collaborative practice and work together, that this will help us to build our workforce capacity, allow access for more patients, and then improve our oral health outcomes for our patients. By educating our students and teaching them how to collaborate, they will really be able to be workforce ready as soon as they hit the ground running when they start working. So what we ask them to use is the oral health delivery framework, which is very simple for primary care providers. All they have to do is ask the patients about their oral health, because it's often they don't think to ask them about it. So just simple things like, do you have any pain in your mouth or your teeth or your gums? Any bleeding? Do you have a dentist? Have you had any recent or current dental care? And what medications are you on, since many of the medications can really influence the oral health? So just asking a few basic questions will give the primary care provider an idea if there could be an oral health issue that they need to help with. And then looking in the mouth. That many medical providers have been taught to look at the head, eyes, ears, nose, and throat and totally skip the mouth. So we have added the oral exam into that, and we call it the HENOT exam. So we want all of our providers to look at the lips and the gums and the teeth and the tongue and the mucosa and notice, are there any problems and what's normal and what's abnormal? And then decide, is this something that needs immediate referral? Do you see a problem here? Do you need to get a dentist right away? Is it something that the patient maybe just needs education, prevention, information on oral hygiene or nutrition or smoking cessation? So once they decide which way to go with the patient, then act. Either you refer them right away to a dentist or get them hooked up with a dental provider and then document it. So this is the oral health delivery framework for primary care providers, which is a very simple way for it to be integrated into everyday care. So we also like our geriatric providers to know that there is an oral systemic connection in our elder care. So with diabetes, it's really bidirectional. People with periodontal disease have 2 to 3 times the number of people with periodontal disease have 2 to 3 times as much diabetes, and people with diabetes have 2 to 3 times as much periodontal disease. So there is a relationship there where a higher, those people with the periodontal disease have a higher risk for higher blood sugar levels and for developing diabetes. And those adults who do have diabetes have more mouth problems because of the increase in the blood sugar, in tooth decay, gum disease, tooth loss, and dry mouth. So it's really a cycle that one definitely influences the other. Because if you look at a person with periodontal disease, you can see anybody with periodontal disease, that's a warning sign that there could be a metabolic syndrome going on. In one study, people with untreated periodontal disease had a 3-fold increase in kidney and heart disease. And we just said before that periodontal disease elevates the A1C markers, the hemoglobin A1C, which could indicate that the patient maybe doesn't have diabetes quite yet, but they're at high risk for it. So anyone who is really, examining the mouth and treating the patient for periodontal disease could be the first provider to notice that this patient really could have a serious metabolic problem. And then we found that periodontal therapy can decrease the inflammation throughout the body so that it will have less inflammatory markers for heart disease. The periodontal therapy can decrease the hemoglobin A1C, so we have less risk with diabetes, and reducing all of the serious complications. So one definitely affects the other, and just treating the periodontal disease really can help so much with any of the either heart or diabetes or kidney disease, just by decreasing that inflammation. So when it comes to the cardiovascular disease, again, people with periodontal disease are twice as likely to have heart disease. And ischemic heart disease and stroke have been associated with periodontal disease due to the general inflammation. It's felt that just the inflammation in the blood vessels have been shown to contribute to atherosclerosis. So whether they're treated or not doesn't seem to actually affect the heart disease or atherosclerosis, but it does decrease the inflammatory markers, which will down the road certainly have a definite better effect on the patient to have less inflammatory markers, and it should eventually help their heart disease. But there hasn't been any study to really show that it does have an exact effect on the disease, but just on the inflammation. And then osteoporosis. We know that people with osteoporosis, with the bone loss, often their gums and the periodontal disease with the shrinking of the bone loss, they can often have loose teeth, loose ligaments, and they start losing their teeth just from the osteoporosis. And then often the drugs to treat osteoporosis can also increase the risk for osteonecrosis of the jaw. So that's something to always be aware of in a patient who has been treated for osteoporosis. There are also some cancer drugs now that are causing some osteonecrosis as well. So those are things to be aware of with any of your patients, what kind of drugs they've been on. And then xerostomia. I think we're all aware that medications, radiation, rheumatic disease, those patients often have dry mouth. And when you look at the elderly population, at least 90% of them are on probably multiple medications. And many of these medications will cause dry mouth. They can cause taste alterations too. So often, with dry mouth, they're going to be at increased risk for dental caries as well. Sometimes their medications can be altered to have ones that don't have such severe side effects as dry mouth. And then with the older adults, nutrition is really so important, but often if they have loose teeth, they have pain, they have dentures that don't fit, maybe the osteoporosis has now made their dentures not fit right, so they start eating very soft foods or unhealthy foods or a lot of junk food because it's easier to eat, and then they can have a lot of problems from poor nutrition because they're not getting good nutrients, and they're at increased risk for more infections and weight loss. So making sure that they have good oral health will really be essential for them to have good nutrition. And now we've really come to see that oral health and dementia, there is a relationship there between people with dementia and poor oral health. And is it that they were starting to develop dementia and then they decreased their ability to take care of their mouth, or is it the inflammation from the oral health plaques that are involved in dementia? So there's a lot of research being done now in dementia and oral health. And a lot of the issues with people with dementia is that they really aren't able to care for themselves, and they start to become more care resistant. If they're in a home or have caregivers trying to help them with their oral care, they often can't, they become aggressive, or they don't want someone invading their space and their mouth. So a lot of people with dementia wind up where no one is really giving them good oral care because it's too hard for them to do that. So if we look at the acute care in geriatrics, we also have ventilator-associated pneumonia. These are patients who go in the hospital, they're put on a vent, and then they develop pneumonia because they haven't been getting good oral care. The increased length of stay is up to 2 weeks, an annual cost of $2 billion, and mortality anywhere from 10 to 40%. So we have found that providing good oral care for patients on ventilators with a definite protocol, called the VAP protocol, can really prevent a lot of these pneumonias. And then we also have non-ventilator hospital-acquired pneumonia, which is the most common hospital-acquired infection in the US. We have an increased mortality up to 29%, increased length of stay up to 9 days, increased costs, and there's a big problem with patients being readmitted in less than 30 days. And again, oral health care has shown to be an effective intervention for patients to prevent hospital-acquired pneumonia, because very often people were not being given care for their oral care while they were in the hospital. And so what happens is they have the dental plaque, and it's a microhabitat. And when they're ill, we said before, there's more pathogens in their dental microbiome, and the bacteria replicates 5 times the amount in 24 hours. So if they just have 1 day without oral care, look how much more bacteria they'll get. And then what happens is they start to aspirate, just little, 50% of adults microaspirate. So when they're asleep, they may aspirate, and then they have poor cough, they're immunosuppressed, and they get the infection in their lungs. And a lot of this can easily be prevented with good oral hygiene by the hospital staff. So we have one nurse who started this protocol in all the VA hospitals, and it's really been proving to be a very valuable protocol where patients are decided what risk they are, and based on that risk, it determines how often they get their oral care. And they have to really stick with this. And they've shown very good results, and they're in like 35 VA hospitals right now. And then if we look at adults at the end of life, often this is where oral care is often neglected. But this is when patients really want their dignity and nutrition and comfort, communication, socialization, intimacy. They need to be able to laugh, talk, smile, talk to their loved ones before they go without worrying about how their mouth smells or or any pain. So we really need to be sure that we're caring for them at the end of their lives as well. So this is a preventive protocol for palliative care patients, being sure to keep the lips moist, making sure inside the mouth is kept moist. And this is when we can use those swabs, and still brushing the teeth if they may need a suction toothbrush for that, making sure you can floss their teeth and just clean the soft tissues and being sure to clean the dentures. So these are all important cares for someone in hospice and palliative care. So it's just going to show you some of the teaching strategies that we've used for helping people, the nursing students, to do oral care for older adults. So this is our oral health nursing education and practice website, and we have lots and lots of resources here, and it's open access. Feel free to go on, and there's videos, there's articles, there's all kinds of information. And then we also have a link to our Facebook and to our Twitter and to our blogs. And then we have a link also to Smiles for Life. Now, Smiles for Life is it's an interprofessional oral health curriculum, and it was designed for non-dental professionals. So all of our nursing students, and it's also used for PAs, for medical students, for social workers, anybody who's involved with the patient can go on. There are 8 different modules, and it's through the lifespan. So we have, the first one is oral systemic health, we have child oral health, adult, pregnant women, geriatric, and then there's fluoride varnish, caries assessment, and dental trauma. So they're excellent, and we highly recommend them because they can do this course in like 45 minutes and hand you a certificate for it. And you can there's tests and case studies. There's also a way for faculty to download the modules and use them to teach students. And then there's also a mobile app which students can use at the bedside. So the 3 courses for geriatrics really are the oral systemic, the oral exam, and then the geriatric oral health. So it would be course 1, 7, and 8. So we would have our students do that, but we also have any of the providers in the area. We encourage them to use these modules too. And this is a very good website. This is our Health Resource Service Administration, and they have a lot of resources for caring for the elderly in oral health and aging, especially resources to give to caregivers. So sometimes this is a program we have called Tooth Wisdom, and it's for the elderly. So we have found that often older people really can't hold on to the toothbrush too well. It's hard for them to grip it. Either they may have Parkinson, or they may have had a stroke, or just some weakness. So making that toothbrush easier to hold by either you can get a pipe insulator, a piece like that, or the bike handles, that works, or sometimes just wrapping a washcloth around it. So it's just a little bit thicker and easier for them to hold. Sometimes even a tennis ball makes it easier for them to hold, so that they can manipulate the toothbrush a little bit better. There we go. So one of the nurses we work with has worked a lot with dementia, and she's developed these oral care cards for caregivers, where she gives them all of these cues on what to do and what not to do when you're dealing with a patient with dementia and you're trying to give them oral care. So she's done some studies on it to show that it's really been effective. And she teaches like the patient care assistants in nursing homes how to use these. And it's just 15 little cards that are just little cues for people to make it easier on the patient with dementia. Because her feeling is that the patients take it as an attack, as you're trying to do something to them, and it's very invasive. So you want to be sure that you first make eye contact with them, make sure it's in a quiet environment, and have a conversation to build trust, not just come at them with a toothbrush. And often they may not want to be touched a lot, but gentle touching, just touching their hand or their elbow. She found smiling was important when you are talking to them, and to talk to them like an adult. A lot of people tend to talk to somebody with dementia in baby talk or little child speak. So just speaking normally to them is much more effective. And then just trying to get them into the idea of brushing their teeth. She said often they just need to be put in front of the mirror, and standing in front of the mirror gives them a cue as to what they're supposed to do. And she found it was important not to stand in front of them and block the mirror, like let them see themselves in the mirror, and stand behind them. And you can help them by either helping them hold the toothbrush, or just if they hold the toothbrush and they're not doing anything with it, you can brush from behind. And it's much less offensive and aggressive and frightening if you're behind them. So all of these different, just giving them cues or gestures, looking in the mirror, and putting your hand over their hand, even if they're trying to take out their dentures, if you're trying to guide them. And she found all of these methods are very, very helpful in dealing with patients with dementia. And this is our article I had mentioned before. We have changed the traditional exam from head, eyes, ears, nose, and throat, which is what we were all taught. Go from the nose to the back of the throat and totally skip the mouth. That we now include the oral cavity, the HENOT exam, so our students cannot forget the oral cavity. So this is what they're all taught. And it's been taken up by many, many schools now where it's the HENOT exam rather than the HENT exam. And it's just become a normal part of primary care. Now this is a project I did with the National League for Nursing. They wanted teaching strategies on it. They have a website for nursing faculty, and they wanted some resources where the nursing faculty could go and teach how to care for older adults. So it's a series of 4 different teaching strategies. One is about oral systemic health in an older adult. The other is an older adult living in the community. The other is how to develop an interprofessional practice with the older adult, and then performing oral health assessments. So these are just different ways that faculty can go and present things like this to their classes. So some of the things were like an older person interview. We'd have the students go into the community or just talk to an older person they know and ask them if they have a dentist. When was the last time they went? How did they pay for their dental care? How did they get there? How many teeth are missing? And just for the students to get an idea of what an older adult's oral health is like, and what health problems they do have, and what medications they're taking. And then we also have them to assess the community that they're in and find out what are the barriers, what dentists are available for the older population within a 10-mile radius. Is there public transportation? What kind of payment is accepted? Is there a sliding scale? Is there a community health center? So we did a project with our senior centers where we put students in them to teach them oral health. And then the seniors said, well, this is great, but we don't have any dentists. And so I had the staff find dentists in the area. And now we have a list of all the dentists that are willing to see these seniors. So, it just takes a little bit of interest and work for them to really get what they need. But it's doable. So another project we have at the senior centers is we just have these sort of different oral health facts at different tables, and sort of like a speed dating setup where the seniors move from table to table and the student presents whatever it is, oral health and diabetes, and a few seniors will sit around and listen to that and ask questions. Then they move to the next table and they learn about oral health. So we try to do a lot of projects like that with the older adults. And this is the caries risk assessment guide, which is really what's used to decide how much risk the patient is having. And there are the protective factors where you want to know if they have fluoride and if they have a dentist and if they've had any dental work. And then there are the risks. Do they have any medications, any diseases? Do they have any eating disorders, medications? So, and it just is, once you go down the columns and figure out how much risk they have and how much factors they have that will balance out the risk, then you can decide what risk they are at. So on our website, we do this interprofessional oral health faculty toolkit. So I had asked to look a little bit at that. So this is for our undergraduates. So the way this works is, in order to get oral health into the curriculum, we've divided it into whatever course. Every course, we don't want the faculty to have to teach a whole new course. We want them to just weave it into whatever they're teaching. So we call it Oral Health Bite. So this would be the nursing care of adults and older adults. And what the students would all have to do is the Smiles for Life courses 1, 3, and 8. And then the faculty could go to whatever they're teaching for the session: nutrition, cancer, leukemia, and they'll pick a topic. And then there's exposure, immersion, and competence. So in exposure, we would just have them read about something. So say in nutrition, it would be reading about trends in decayed teeth among older adults. If it was cancer, it might be about oral mucositis. In leukemia, it might be oral manifestations of early clinical signs of AML. So whatever article, to be sure they integrate oral health into whatever topic. And then they would do the Smiles for Life, and then we have an interprofessional collaboration. So they would pair up with either dental students, social work students, whatever we have around, pharmacy students, and develop an interprofessional collaboration around, say, nutrition. We would have them meet with the nutrition students. If we had them with cancer, we'd have them maybe meet with the medical students and develop a care plan for a patient, so that whatever topic we're doing, there has to be some oral health in it. So just to show you, it goes on in this course: kidney disease, GI disease, and cardiovascular. The same thing. What's exposure? They read something. Immersion is they do something. And then in competence, they have to have an interprofessional collaboration. We do that with each of the courses. And this one is with VAP and non-VAP, dementia, Parkinson's disease, So whatever topic we went through, all of the syllabi, whatever topic we could find, we found what oral health, what was important about oral health for that issue. Maybe in Parkinson's, then we'd have them maybe collaborate with speech and language students. And again, it goes on for about elder care, end of life care, older adults. So the same pattern goes throughout. And then that was for our undergraduate students. So this is for our nurse practitioner students. And these are the ones who are caring for older adults, the adult primary care nurse practitioners. So their curriculum is different, and we have oral health for their health assessment class, their health promotion, and their primary care class. So we go through that. The idea here, they have exposure, which is an introduction, immersion, which is their development, and their competence is entry into practice. So for whichever, like say the first thing is the oral exam, then they have to do the Smiles for Life, they have to do those teaching strategies. If they're doing oral care for adult, the patient facts, whatever it is, they do an exposure, then they do an immersion, some sort of activity, and then a collaboration again. So it's just at a different level. And they're all based on the interprofessional competencies and the oral health competencies, as well as the nursing competencies. So we use these, they're on our website. Anyone can go in and pick and choose whatever they want. So that they're already there. Nobody has to go and research and find an article they need. They can just choose whatever their interest is for the day. And then we have the Smiles for Life, which is the mobile app. So you can download this, and it has a great photo gallery. So, you know, if the students see something in the clinic, they can look and see if it looks like something in the photo gallery, or we can give them these different lists, and they have to find something matching the photo gallery. There's diagnostic modules, there's risk assessment tools, so they can use that. This is the acute care nurse practitioner toolkit. So it's basically the same thing, but more for patients who are in the hospital, and for the nurse practitioners and things they have to do for those patients. So again, for this program, they just use the same idea as they go through the primary care program. And then we have different case studies for them, like design an oral exam and a treatment plan for a 61-year-old man with a prosthetic mitral valve who is going to get deep cleaning. Right? So if they will need to figure out if the patient needs an antibiotic or what they have to do. Then we have a diabetes case study where they have to make a plan for this patient too, in terms of his symptoms of diabetes as well as his oral care symptoms. So this is more of the acute care program. So the whole idea is that the faculty can just go in, pick and choose what they find valuable for themselves and their students. And again, this is another type of photo gallery and more of the curriculum. This one is for the acute care 3. So basically, we need you to be sure to take care of these older adults now, because it has been the missing piece in older adult care. So, see if you have any questions. Yeah.
In the beginning, there was regarding liver ulcers, there was gastric ulcers. What's meant by gastric ulcers?
Gastric ulcers, I'm sorry.
in the beginning, there was, different kinds of ulcer, it said. In those ulcers, there was one thing, it says gastric ulcers. What's mean by gastric ulcers?
I think, was it when I had the list of different diseases that have oral systemic connections? Is that what you mean?
Yeah.
Let me look and see.
Before that.
Oh, gastric cancers. Yeah, I mean, the idea for that was that any patient who has cancer is at risk for oral problems from the different drugs, from refluxing, things like that. That they can also have oral problems if they're taking chemotherapy, radiation. They can get mucositis, and oral ulcers. Yeah, so the idea was any type of cancer, esophageal can definitely, I mean, the mouth is all part of the GI system, so it's certainly all related.
Thank you.
Okay.
I have a question. How effective was was creating the awareness? There's at one point where there was like kind of a forum, or not sure if it was classes, or they were just creating this awareness within the older community about the importance of oral health. And I just wanted to know how successful that was.
So when we went to the senior centers,
Yeah.
and we brought students, and we did this education program called Tooth Wisdom, and we did it for the seniors, for the home health aides,
Yeah.
for the volunteers, and for the case managers. And we did a knowledge survey before and after, and we were able to show that their knowledge definitely increased, and the way they reported their behaviors, their oral health hygiene behaviors also improved according to, their self-reported.
Yeah.
So we found it was effective to let them know, and then to get the response from the older adults as well. Now that we know all this, where are we going to find a dentist? And being able to meet that need, that they realized they really wanted to continue with their care.
Yeah.
So we felt it was an effective program. Just, making them more aware of what their needs were.
Thank you.
Yeah. Yeah, there are toothbrushes which actually, when a patient can't really spit out, they have a little suction tube on them that you can get the saliva out from the toothpaste. Yeah, I mean, they're in different places. I think it's not actually provided by the hospital, but you can get it for the patient.
What are the compliance rates with the nurses once they learn, have this education, and when they go and get employed? Are there any follow-ups with them?
So we haven't been able to get those studies done yet on how they are integrating the oral health later in practice. But what we've done is we didn't want to just educate students and then leave all these people in practice out there with not getting up to date. And we didn't want to send our students out to people who weren't doing oral health, and then the students were trying to do it. So we've had preceptor workshops where we invite them in to learn about oral health. And those have been pretty successful. And we've gone out to different sites, different hospital sites, or the school nurse, school-based clinics and things like that, so that those people that we're sending our students to are teaching them what we want our students to learn. But as far as have we been able to follow our students longitudinally, not yet. We haven't, but we would really like to do that. Sometimes we'll hear from them that they, what they're doing, but we only hear the ones that are doing something they want us to know about, right?
How many conferences across the states have you managed to present this at? Because the feedback from people, they're going, wow, we should do this as well. I should think, yeah.
Yeah, I mean, we've been, our goal was to have a national nursing curriculum. So right now we have different nurse initiatives, oral health nurse initiatives in all 50 states. So we've been able to, you know, certainly we don't have everybody on board, but we feel like we're getting there. Yeah.
So how do you know, like, which artists are going to be hospital-based?
I'm sorry, I didn't hear you.
As they know, like, the hospitals are case-based in case.
Mm.
How do they know, like, how are they getting the support? So, like, toothbrushes, toothpaste, who provides these services? Or are they getting it provided by the patients, or is the hospital providing it for them?
So the hospital that I'm mainly involved in at NYU, they have a big oral health program, and like every patient who goes to the OR has to brush their teeth before they go to the OR. So they all get toothbrushes. And then I was involved in this mucositis program so that all of our cancer patients would be on the same protocol. And we had to make oral health kits for all of those patients so they would all have exactly what they needed. But usually a patient will just get a toothbrush when, you know, when they're admitted. But if they need anything special, they, you know, would have to be ordered. But they should be getting a toothbrush and toothpaste just as part of, you know, when they get soap and.
So, if, for example, when you say something special, like, say, for example, they needed, at the moment, they're quite reluctant to order Curacent toothpaste. So, if, for example, they needed Curacent toothpaste, would you be providing that, or would the hospital be providing that?
Well, we wouldn't. No, we don't provide anything really. The hospital, they would have to order it, and it would be, you know, billed to the patient. I mean, we get things donated, and we have a program, you know, in the Bellevue Clinic where we bring toothbrushes and toothpaste and, you know, little flossers and things like that. So the kids all get a goodie bag, things like that. Or maybe if we go to a conference, we'll bring toothbrushes, but we don't really provide anything for the hospitals or other schools.
So the insurance has the item number, you can say that oral hygiene product, and that's the charge for the insurance to pay if it's through insurance.
Yeah, I don't know I don't really know, but as far as like when we were making these oral kits for the mucositis team, we had to they had to be approved by the committee that all the billing goes through. So we had to, you know, look at all the different toothbrushes and see what would be the best for the patient, but what was cost effective as well.
The courses that you had there, they're all online courses?
No, all of our those projects are on the toolkits are online, but they can be used for online teaching, or NYU doesn't have many online courses. It's pretty much all in person. So those you can use in person, or anybody, they're available to anybody. They can use them online or however they like.
So they're available for anyone to
Yeah, anybody can use them. So
I
you just go to our website and take whatever you want.
yeah.
So if it's online or in person, it doesn't matter.
Anybody on Zoom, if you'd like to ask a question, please feel free to unmute and ask the question if you wish to.
No. Okay, anyone else?
Thank you very much. Please
Okay.
join me in thanking